Hi there, my name's Abby Mackay. My student ID is 1096242. This is my assessment task 3 for complex care, NUR331. This is going to be a video presentation of an example of clinical handover that happens every day in the nursing practice. In this case, this will be a handover for Travis Jones, who was also my case study back in task 2. Okay, so Travis Jones is 18 months old. He has been admitted to the ward today with bronchiolitis. His mother is here with him and her new partner, Joe. They're both quite young parents, and on the admission, they did ask if they could leave to go and have a cigarette. So obviously they are smokers and the home environment would be polluted with smoke, and he will be receiving secondhand smoke, which could very well be contributing to his bronchiolitis and his respiratory distress. Definitely not helping it. If you could assess that further, that would be great. It maybe give them some education on the dangers and the risks of a young child like that being exposed to pollutants like that. So his observations on admission: his temperature was 37.8. His heart rate 152, respiratory rate 60, O2 saturations 94%. He's 15 kilos, mild tracheal tug present and chest recession, increased respiratory effort as well on observation of the chest. History: he was born full term and bottle fed, currently on 4 bottles a day. His mother says all he's eaten today were hot chips from McDonald's, and she also admits to not having any food at home to provide him. That's sort of grey area that really needs to be further assessed as well, just to see what his home situation is at home. What I can gauge, it's not that great. He's up to date with all of his vaccinations, strong family history of asthma. I noticed his younger 4-month-old baby sister has a runny nose and conjunctivitis as well. His milestones seem appropriate to his age, but do need further assessment if you get the chance. The doctor has ordered 2 litres of nasal oxygen on nasal prongs at the moment for Travis. He seems to be tolerating them really well, and his O2 saturations have actually risen to 96% over the last 5 minutes. So if you continue to monitor that closely, that would be fantastic. I believe the doctor is going to write up a med order for paracetamol and bronchodilators, so just touch base with him and keep an eye on his med chart to wait for that order to come in. He's been a little restless, but he's much improved since his admission today. He's pretty cooperative with the assessments, really nice little kid. In the meantime, if you could get the opportunity to be able to discuss with the parents, of course, the risks for Travis with the smoking, the secondhand inhalation, it's especially with a strong family history of asthma, that's not going to be very good for him at all. Also, the lack of nutrition going on, that's something that needs to be discussed as well. Thank you for listening to my presentation.